Ladies and gentlemen, welcome to yet another medical segment with Dr. Zahir Babar. I am your host, Omar, and thank you for tuning in. Doctor, thanks for being here yet again, and thanks for giving us the time to answer all the questions on the behalf of...
Thank you, Omar. Thank you. My pleasure.
Thank you very much, Doctor. So, again, very quickly, a brief introduction into alternative medicine. What are the pros of it, and why should people opt in for it?
Okay. So, as I explained in my last two episodes, what is the actually alternative medicines? So, so many people, they are asking me the question, so many my patients, they ask. So, I want to clarify, the alternative medicines is the same way like allopathic medicine, we diagnose the same way. But the difference between allopathic and the natural medicines is this. First, we do the diagnose like an allopathic system, like a normal in the general medicine, and then we prescribe effect of the alternate, the chemical medicine. So, I give the natural medicine which have no side effects. So, it can be carry on for the long time. So, this is my answer.
All right. Excellent. So, we've had quite a few people actually write in to ask questions. So, let's start with the first question that we received. And by the way, for any of you watching, feel free to reach out to Dr. Zahir through the website, which you can find on the screen as well. Now, the first question comes from Mohammed in Dubai. He writes and says, I'm a 32-year-old male diagnosed with arthritis. I constantly suffer from pain, stiffness, and swelling. And to make matters even worse, I am a professional bodybuilder using bodybuilding supplements and now taking painkillers and anti-inflammatories. My doctor has warned against liver damage and asked me to stop taking the bodybuilding supplements necessary for me to gain mass. What alternatives do I have, as I don't want to lose my bodybuilding career?
Yes, Muhammad. Thank you very much for your question. First of all, Muhammad have to thanks to his doctor, because he gave him the very good advice that if he will continue with the anti-inflammatory, so it can damage his liver. So he should have to say thanks to him, because he explained him properly. So on the other hand, he is already taking some supplements which for the bodybuilding, so which I believe there are the proteins and amino acids he is taking. So these are already heavy for the kidneys. So not only liver, he can have a problem in the kidneys. So he have to be very careful. So there are so many alternative methods for the pain management, especially because his symptoms, obviously he have a swelling of the joints and the pain. So first of all, I have to visit him and I have to check his height and weight, and then I will guide him about his disease, and I will give him some natural supplement which we call the natural medicines, which will be the homeopathic, and he don't need the anti-inflammatory medicine. But obviously it cannot be worked from very first day. Probably he need a couple of weeks to be reduce the pains.
Sure.
But there are so many solutions which he can save his liver and kidney.
So essentially, I mean, what you're saying is he can actually come off these pharmaceutical, chemical drugs, medicine, so on, continue to take his supplements for bodybuilding, but then also find alternative options in natural medicine that are more natural remedies,
yes,
right?
Yes.
But then continue to take the bodybuilding supplements.
Yes, I am always against of this, because I have to check, because so many people, they do mistakes, this taking so many proteins and amino acid, which is anyway, if he's not taking any medicine, which is harmful. So he have to take the advice from some specialist doctor, so he can continue or not. So that's in his case especially, I will advise him to come, and then I will do the clinical visit properly, and then I can advise him whether he can carry on or not these supplements, because the health is important, not the body.
Right.
As my advice.
And very quickly, before we move on to the next question, this is actually for me, I'm curious.
Yeah.
Could the inflammation and the joint pains and so on be a result of the extensive workouts?
No, answer can be yes and answer can be no.
Okay.
So I cannot say probably it's for the workout, or probably he have some family history.
Right.
So this we have to diagnose.
And is that something that you can discover, whether this is family-based, or hereditary, and so on?
Of course.
Okay. All right. Fair enough. Let's move on to the next question, which is actually quite interesting. You have, obviously, I know that you operate in the UAE, in the UK, and especially in Italy. In fact, you speak Italian fluently. And you have quite the following from Italy. So we actually had somebody by the name of Roberto who wrote in from Italy. The trick is he wrote it in Italian, so we had to translate it on our own.
Okay.
So excuse me for any mistakes, but I'm sure you'll get the overall message here. Roberto says, I suffer from chronic depression and panic attacks along with sleep disorder. Are there alternative healing methods available for me that can improve this? Also, when and where will you be in Italy so I can try to visit your clinic? And by the way, it was just coming to me, instead of us having to, translate this somehow later on, you might as well answer it in Italian, I guess. So, and you can actually talk to Roberto right there in the camera if you want.
Ok, caro Roberto, ciao. Allora, tua domanda era bellissima, quindi in medicina alternativa sono tante soluzioni, solo che non si può lasciare medicina chimica subito, quindi gradualmente possiamo lasciare medicina chimica, poi ti posso mettere sulla medicina alternativa. E poi seconda domanda tua era che quando sarò in Italia, io in Italia sarò questo mese, no, mese prossimo, novembre, quindi fine di mese sarò là, quindi puoi vedere sul mio sito il numero di mio studio o di mio segretario e puoi fissare un appuntamento dove ti spiegherò bene per riguardo tua malattia e soluzione alternativa. Grazie, ciao. I speak in Italian.
I'll get the English version after the episode from you, and we're also going to have the subtitles for those who are actually watching it. So that concludes our episode for today. Thank you very much, Dr. Zahir, and we're looking forward to yet more questions from the audience and another episode soon next week, hopefully. So thanks again.
Thank you very
appreciate
much.
your time. Ladies and gentlemen, there you have it. That was another medical segment with Dr. Zahir Babar. I am your host, Omar. Make sure that you tune in to the next episode. Until then, see you later.